So a major issue specifically to this area is that the Anschutz Medical Campus is this grandiose place with two amazing hospitals and all these different schools and research buildings and everything. And there's a disconnect between that campus and the community around it. And we saw that the community around this area is incredibly high in need for what they need in healthcare and other social services as well. If you look at a Truven Health Analytics Needs Index that's published online, you can see that the area surrounding Anschutz Medical Campus is of the highest need and has some of the greatest barriers to achieving health. And that's not just health care, which is what the Dawn Clinic provides, but also care in other aspects of their life. So part of the goal of Dawn Clinic is to improve the health of our community and really build that connection between the campus and the community such that we are actively helping them.
Another thing that we're really trying to do with this clinic is really kind of bring innovation and change to primary care. So we know that with primary care, the demand and the supply is off balance. We know there's a huge demand coming with the baby boomer generation, just more people being covered with insurance. We know that there's a higher demand for primary care. When you look at the specialties and what everyone's going into, the supply of clinicians going to primary care is not meeting that demand. So because of that, we wanted to bring a change. So through our organization, we and the clinic, we really want to bring this change. And it's through an interdisciplinary care that we really think that by doing so, we can bring truly comprehensive care. And one thing that really kind of happens is, one thing that we've noticed with each of our professions is we each are in our own silos. So with the previous, with the healthcare system as it is, we're each in our own little contained silo where it's our profession. So because of that, when patients are moving through the different silos as they're getting different care, there's a lot of loss of follow-up because there's lack of communication between the silos. And what's happening is, because the patient is just moving through and we just assume that the next one will just take on the care, we don't explain things properly to the patient. They'll show up to the next silo and actually see a problem and not actually know what's going on. So because of the silo change, it's actually been kind of problematic. So one thing that we're trying to do is we're trying to break down those silos. By breaking down those silos, the patient is now involved directly with their care, and we're all in a team together, and the patient is in that team. And in the end, what we're trying to do is build a silo, one silo that surrounds everybody. So we're all in it together. It's not about each of the professions anymore. It's about truly an all-encompassing healthcare, and that's what we want to do. So the pharmacy students are involved in a variety of ways. So one thing that we're going to be doing is chronic disease state management. So if a patient comes in with hypertension, diabetes, things like that, a pharmacy student will play an active role in managing that disease state. The other thing that we're going to be doing as well is medication reconciliation, as well as pharmacy consults. So any questions with medications, drug interactions, side effects, 4R generics, things like that, they can consult us for those. Another thing that we're also doing with the clinic is a lot of leadership positions, such as being part of different subgroups, such as testing, pharmacy, advocacy, so forth, as well as being clinic managers to really help with the flow of the clinic every night.
So thank you so much for joining me, David, and Jeremy today. We'll be publishing other blogs and videos soon to talk more about our experiences with the clinic, and also bringing in other professions to talk to you about their involvement and how we've all been able to bring this together.